Are you getting up 3 or 4 times at night to pee? Is your flow really weak, or do you even rush to the toilet in the daytime? If you do, it's possible that you have symptoms related to an enlarged prostate. And you may be thinking that there has to be a better way than putting up with your current situation. For many men, they are scared or polarized about going to talk to their local doctor about their urinary issues because they think it ends up with an operation, and that operation can spell the end of sexual function. Now, that's not necessarily the case, but there are options that men have to improve their situation, and one of those is medication. Hi, my name is Dr. Charles Chabert. I'm a urologist and director of the Prostate Clinic, which is located on the Gold Coast in Australia. In today's video, I wanted to talk to you specifically about a combination therapy to manage urinary issues related to an enlarged prostate. And if you stick around to the end of the video, I'll let you know the ideal candidate for using this particular medication. As always, if you get benefit, please give the video a thumbs up or subscribe to our channel. 90% of people who actually watch our content don't subscribe. And if you don't hit the subscribe button, the probability that YouTube shows you another video is low. So it would really do us a big favor if you do subscribe to the channel. Okay, let's get into it. So a big prostate, the medical terminology is BPH, or benign prostatic hyperplasia. In essence, the prostate is shaped like a donut. It sits underneath the bladder, and as we get older, that donut or the prostate gets bigger. It blocks off the outlet pipe of the bladder, which is called the urethra, and men develop obstructive and irritative symptoms. The flow is slow. It takes a long time to pee. There's hesitancy to get started, even though you feel busting for a pee. And there are bladder symptoms. And the most annoying bladder symptom that I see in my clinical practice at the prostate clinic is men being frustrated with getting up multiple times at night to go and pee. In the daytime, they have frequency or go more often, and they can even rush to the toilet and sometimes get caught short. Now, there are different classes of drugs that are used to treat BPH. The entry level is something called an alpha blocker, and examples of this include drugs like fusasin, tamsulosin, silodosin, prazosin. There are some nuanced differences between these, but in essence, these drugs work in a similar way. They're a smooth muscle relaxant, and they relax the muscle in the urethra or the outlet pipe of the bladder to try and improve function. Now, there's another class of drug called a 5-alpha reductase inhibitor. Now, this drug works in a different way. It works by preventing the conversion of testosterone, which is the male hormone, and preventing that from being converted into the active metabolite. Now, the process of doing this actually works by gradually, progressively shrinking the prostate. So we actually get a reduction in the size of the prostate gland itself. By the way, if you've had experience with either of these drugs, if you have a comment or a question, or you'd like to share your experience, please leave it in the comment section down below. Now, depending on where you are geographically on the globe, you may be aware of a combination tablet that contains some tamsulosin and some dutasteride. So tamsulosin is the alpha blocker, dutasteride is the 5-alpha reductase inhibitor that can shrink the prostate. The original 5-ARI was finasteride, and the trade name for that was Proscar. We now have dutasteride, which is a second generation 5-alpha reductase inhibitor, and that is traded under the name of Avodart. Now, here in Australia, we have a combination tablet that contains some tamsulosin and also some dutasteride. Now, the way that works, the tamsulosin component works almost immediately. So the benefit literally can be felt within hours of taking the tablet. As indicated, it's a smooth muscle relaxant, so it takes the pressure off the outlet pipe or the urethra, and men can perceive fairly rapidly that their flow is better and they have a reduction in their frequency. Now, the dutasteride component takes time, and this is the part of the medication that actually shrinks your prostate, as I said, by preventing or reducing the conversion of testosterone through to its active metabolite. So we have less of that active metabolite, and in essence, there is a reduction in the size of the prostate. Now, if you take a 5-alpha reductase inhibitor for 6 months or more, we can reduce the size of your prostate by around 20 to 30%. Now, let's talk about side effects from these drugs. There's nothing that we do that is free from side effect, but it's also important to remember that doing nothing also has a cost, and that cost really, for the majority of men, relates to quality of life issues. So the tamsulosin component, the most common side effect that I see is what's called postural hypotension. Men feel lightheaded, and that's brought on by going from sitting to standing or lying going to standing up. The other thing that men can experience is some stuffiness in their nose. They feel almost like they've got a bit of a head cold when they take it. These symptoms, if men do experience them, tend to be more common at the start, and men can adjust to them. But as always, if you get a side effect from a drug and you don't like it, please discontinue it and go and talk to your local doctor about alternatives. Now, with dutasteride or any 5-alpha reductase inhibitor, the potential side effects can relate to sexual dysfunction. So number one, it can reduce your libido. It can also make your erections not as hard and not as durable as they once were. The other thing that men can notice is something called tender gynecomastia. Fancy term, but in essence what that means is that men can notice that they develop tender, swollen breast tissue. Okay, so who is a candidate for this combination tablet? Well, there was a trial a couple of decades ago. It was called MTOPS, which was the medical therapy of prostate symptoms. Basically, it looked at different groups of men, and it gave men either an alpha blocker or alternatively a 5-alpha reductase inhibitor or combination therapy. Now, the people who got the biggest improvement from combination therapy were those men with a bigger prostate, defined as over 40 cc's, those men who had a PSA level above 1.4, those men who were above 65 years of age, and who had a residual volume greater than 100 mils. So if we wanted to look purely at prostate characteristics and determine who's going to get the biggest benefit from combination therapy, crudely speaking, it's going to be older guys with a bigger prostate who basically have more of a plumbing issue and retain more urine. Now, we have to obviously balance that up with what a man wants. So does a man want to be on medication, or does a man actually want definitive therapy? And many men are polarized. Many men want to avoid surgery or minimally invasive treatments at all costs, and that's fair enough. And other men don't like the idea of being on drugs and would much rather have definitive therapy than being on a tablet that they have to take every day. You know who you are. Some men obviously will choose the status quo and will put up with their urinary symptoms as they currently stand. Now, in my practice, the ideal man for being managed with combination therapy is an older guy, and in my experience, that's usually over the age of 70. He needs to be not interested in sexual activity. Many men are, a lot of men have given up the ghost, as it were. So be aware of which category you fall into. If sex and sexual function is important for you, then being on a 5-alpha reductase inhibitor is not a great idea in my opinion. We don't want to run the risk of reducing your libido or making your erections not as good. So don't take the medication, even if your prostate characteristics are more favorable, that would suggest that you would get a better benefit from combination therapy. You know who you are. So in my experience, over the age of 70, disinterested in sexual function, larger prostate, higher PSA, retention of urine, you are the man that's going to get the biggest benefit from taking combination therapy. And in Australia, that is with a tablet called Duodart, or alternatively doublets. Let's play the counter to that. Say you're a younger guy, say you're in your 50s, obviously interested in sexual function. You have a prostate of around 30 cc's. you retain a small amount of urine and your PSA is around 1.2. Now, in that situation, the entry-level medication is going to be with an alpha blocker such as tamsulosin. As you can see, there are horses for courses, and one size does not fit all. If you've got urinary issues and they bother you, have a chat with your local doctor about the options of how you can manage them. If you got benefit from the video, please subscribe, give it a thumbs up. If you'd like to know more about your prostate, have a look at this video, or alternatively, have a look at this video. And if you do have a question, please join the channel, become a member. We have a live event on the last Thursday of every month, GMT plus 10, 7:30 in the evening. So that's Brisbane time, 7:30 p.m., the last Thursday of every month. Hope to see you then. Get your questions in. Until then, take care of your prostate.